Hi, Professor. As a nurse, I remember the time I was assigned to care for an elderly Chinese patient who was admitted for with pneumonia. Being a nurse for about 3 years at the time, I hadn't gotten like enough exposure on Chinese culture, and I found it so challenging to communicate effectively with this patient and his family. Um, the challenges I face culturally first, I don't speak Mandarin, and this patient's primary language was solely Mandarin, and we relied on we relied for the use of interpreter, which led to misunderstanding and hinders effective communication with this patient. Again, I objected to his mention of traditional Chinese medicine for healing practices as irrelevant to his medical care, failing to acknowledge the potential impact of this medicine to his well being and treatment outcomes. Again, to manage the situation and provide the best care for this patient after these challenges that I had, I did invest some time and effort in building rapport and trust with his family member and with him included, demonstrating empathy, patience, and sensitivity to their cultural needs and values. Again, I actively involved his family and other healthcare providers in decision making for his treatment plan, ensuring that his care was culturally sensitive and aligned with his preference and values. To improve on my deficiency, the first step I took was self awareness. I acknowledge my deficiency in cultural competence and I recognize the importance of addressing it for the well being of my patient. With this acknowledgement, I actively sought out educational opportunities to enhance my understanding of the Chinese culture, language, healthcare beliefs, and then enroll in cultural competence courses and workshops specifically tailored to meet the needs of the diverse patient population. Again, I became an advocate from that instance for cultural sensitivity within my facility, promoting awareness and education among my colleagues, and advocating for policies and practices that recognize cultural competence in patient care. Then, to ensure I continually learn and improve on cultural competence to become the best provider possible as a nurse, psychiatric mental health nurse practitioner, I will adopt a client-centered approach to care that recognize and respect the cultural values, beliefs, and preference of each patient under my care. I will take time to inquire about the patient's cultural background and experiences and incorporate all this information into their treatment plan. I'll regularly engage in self assessment to evaluate my own biases, assumptions, and areas for growth. And then I will reflect on these interactions within clients and the diverse background and seek feedback from my colleagues and supervisors to identify areas where I can improve. Also, I remain committed to pursuing ongoing education and training in cultural competence. I'll continually try to attend seminars, workshops, and conferences which are focused on cultural diversity, mental health disparities, and culturally sensitive care practices. Thank you.